Welcome to our comprehensive guide on gingival curettage. In this video, we'll explore what gingival curettage is, why it's performed, the different types, and what you can expect during and after the procedure. Whether you're a dental professional or someone interested in periodontal health, this overview will provide valuable insights into this important periodontal therapy. Let's begin by understanding the basics and setting the stage for a deeper dive into the rationale, techniques, and healing process associated with gingival curettage. Gingival curettage is a specialized periodontal procedure that involves scraping the inner aspect of the diseased gingival wall within a periodontal pocket. The main goal is to remove the ulcerated epithelium, hyperplastic pocket lining, and the adjacent zone of damaged connective tissue. This process extends downward and outward until it reaches the healthy, firm part of the gingival corium. By targeting these specific tissues, gingival curettage helps to create a healthier environment for the gums and supports the healing process. The primary purpose of gingival curettage is to eliminate chronically inflamed granulation tissue from the lateral wall of the periodontal pocket. This tissue often contains fibroblastic and angioblastic proliferations, areas of chronic inflammation, dislodged calculus, and bacterial colonies. By removing these problematic tissues, the procedure aims to reduce inflammation, promote healing, and restore the health of the gums. The result is a cleaner environment that supports the reattachment of healthy tissue. After gingival curettage, the gingival wall shrinks as the inflammatory infiltrate resolves and tissue fluid drains away. The exposed connective tissue begins to re-epithelialize, forming a new lamina propria, sulcular lining, and epithelial attachment. This process helps restore the original microvascular quality of the gums, leading to healthier and more resilient tissue. Proper healing is essential for the long-term success of the procedure and the maintenance of periodontal health. There are several types of gingival curettage, each with its own specific approach. The main types include gingival curettage, which removes inflamed soft tissue lateral to the pocket wall; subgingival curettage, performed apical to the epithelial attachment; and inadvertent curettage, which occurs unintentionally during routine scaling and root planing. Additionally, there are other methods such as surgical, chemical, ultrasonic, and laser curettage, each offering unique benefits and applications. Gingival curettage specifically refers to the removal of inflamed soft tissue located lateral to the pocket wall. This technique is focused on cleaning out the diseased tissue that lines the periodontal pocket, which is essential for reducing inflammation and promoting healing. By targeting only the affected area, gingival curettage helps preserve as much healthy tissue as possible while addressing the underlying periodontal issue. Subgingival curettage is performed apical to the epithelial attachment, meaning it targets the tissue below the gum line and beneath the point where the gum attaches to the tooth. This approach is used when deeper cleaning is necessary to remove inflamed or infected tissue that cannot be reached with more superficial techniques. Subgingival curettage is particularly useful in cases of advanced periodontal disease. Inadvertent curettage occurs unintentionally during routine scaling and root planing. While the primary goal of these procedures is to remove plaque and calculus from the tooth surface, sometimes the inner lining of the periodontal pocket is also removed in the process. Although not the main objective, this incidental removal can still contribute to improved periodontal health by reducing inflammation. Beyond traditional mechanical curettage, other methods include surgical, chemical, ultrasonic, and laser curettage. Surgical curettage involves direct removal of tissue with instruments, while chemical curettage uses caustic agents to destroy diseased tissue. Ultrasonic curettage employs vibrations to disrupt tissue, and laser curettage utilizes focused light energy for precise removal and improved healing. Each method has its own indications and advantages depending on the clinical scenario. Gingival curettage is indicated in several clinical situations. It is often used as part of new attachment therapy for moderately deep infrabony pockets where closed surgery is preferred. It can also serve as a non-definitive procedure to reduce inflammation before more extensive surgeries, such as flap procedures. Additionally, curettage is beneficial for patients who cannot undergo extensive surgery due to age or systemic health issues, and as a maintenance method during recall visits for recurrent inflammation and pocket depth. As part of new attachment therapy, gingival curettage is particularly useful in treating moderately deep infrabony pockets. In these cases, closed surgery is often advised, and curettage helps prepare the site for optimal healing and reattachment of the periodontal tissues. By removing inflamed tissue, the procedure creates a healthier environment for the gums to reattach to the tooth surface. Gingival curettage can be performed as a non-definitive procedure to reduce inflammation before pocket elimination surgeries, such as flap procedures. By decreasing the inflammatory burden, curettage helps improve surgical outcomes and patient comfort. This step is especially important in cases where immediate surgery is not possible or when preparing the tissues for more extensive intervention. In patients where extensive surgery is contraindicated due to age or systemic health complications, gingival curettage offers a less invasive alternative. This approach allows for the management of periodontal disease without subjecting vulnerable patients to the risks associated with more aggressive surgical procedures. It is a valuable option for maintaining oral health in populations with special medical considerations. Gingival curettage is also used during recall visits as a maintenance method for recurrent inflammation and pocket depth, especially after prior periodontal surgery. By periodically removing inflamed tissue, clinicians can help maintain periodontal health and prevent the progression of disease. This ongoing care is essential for patients with a history of periodontal issues. The basic technique for gingival curettage involves performing the procedure under local anesthesia. A selected curette is adapted with its cutting edge against the diseased tissue. The instrument is inserted to engage the inner pocket lining, typically using a horizontal stroke. The pocket wall may be supported by external finger pressure to stabilize the tissue during the procedure. In subgingival curettage, the technique involves a scooping motion to remove tissue between the pocket bottom and the alveolar crest. This approach allows for the effective removal of deeper inflamed tissue that cannot be accessed with more superficial methods. The procedure is performed carefully to avoid damaging healthy structures while ensuring thorough cleaning. The excisional new attachment procedure, or ENAP, is a definitive subgingival curettage technique. It involves making an internal bevel incision from the free gingival margin apically below the pocket base. While preserving the interdental tissue, the excised tissue is then removed, the root surface is planed, and the wound edges are approximated to promote optimal healing and reattachment. Ultrasonic curettage uses high-frequency vibrations to disrupt tissue continuity, lift the epithelium, and alter fibroblast nuclei. This technique results in decreased inflammation and improved healing. Ultrasonic devices offer a less invasive and more comfortable alternative to traditional mechanical curettage, making them a popular choice in modern periodontal therapy. Chemical curettage involves the use of caustic drugs, such as phenol or sodium sulfide, to destroy diseased tissue. While this method can be effective, it is challenging to control the extent of tissue destruction, which can lead to complications. Chemical curettage is less commonly used today due to these risks and the availability of more precise techniques. Laser curettage utilizes focused light energy to target both soft and hard tissues. The bactericidal and detoxification properties of lasers help remove the epithelial lining and improve healing, especially in moderate or inaccessible periodontal pockets. Laser technology offers precision and enhanced patient comfort, making it a valuable tool in periodontal therapy. Immediately after gingival curettage, a blood clot forms at the site. followed by hemorrhage and an increase in polymorphonuclear leukocytes, PMNLs, on the wound surface. This initial response is crucial for protecting the area and initiating the healing process. The wound may appear bright red and hemorrhagic during this stage. Following the initial healing response, there is rapid proliferation of granulation tissue at the curettage site. This new tissue helps fill the wound and supports the restoration of the sulcular lining. Granulation tissue is rich in new blood vessels and cells that are essential for proper healing and tissue regeneration. Sulcular restoration typically takes place within 2 to 7 days after gingival curettage. During this period, the wound heals and the new sulcular lining forms, providing a protective barrier for the underlying tissues. Proper oral hygiene during this phase is essential to ensure optimal healing and prevent infection. Immediately after the procedure, the clinical appearance of the gingiva is typically hemorrhagic and bright red. This is a normal response to the removal of diseased tissue and the initiation of the healing process. Patients should be informed that this appearance is temporary and part of the normal recovery. 1 week after gingival curettage, the gingiva typically shows reduced height, an apical shift, and slightly reduced redness. These changes indicate that the healing process is progressing well, with inflammation subsiding and tissue beginning to return to a healthier state. By 2 weeks after the procedure, and with proper oral hygiene, the gingiva usually returns to a normal appearance. The tissue regains its healthy color and texture, and the sulcular lining is fully restored. This marks the completion of the healing process for most patients. Before performing gingival curettage, it is important to prepare the patient. This includes reviewing their medical history, ensuring there are no contraindications, and explaining the procedure and expected outcomes. Local anesthesia is administered to ensure patient comfort during the procedure. Selecting the appropriate curette is crucial for effective gingival curettage. The instrument should be sharp and properly adapted to the contour of the tooth and pocket. Using the right tool ensures thorough removal of diseased tissue while minimizing trauma to healthy structures. Local anesthesia is administered to numb the treatment area and ensure patient comfort. This step is essential for pain management and allows the clinician to perform the procedure thoroughly without causing discomfort. Proper adaptation of the curette is key to effective tissue removal. The cutting edge should be placed against the inner aspect of the pocket wall, and the instrument should be moved with controlled strokes to remove the diseased tissue. Careful technique minimizes the risk of damaging healthy tissue. During curettage, the pocket wall may be supported by applying external finger pressure. This helps stabilize the tissue, making it easier to remove the diseased lining and reducing the risk of accidental injury. After the diseased tissue is removed, root planing is performed to smooth the root surface. This step is crucial for removing any remaining calculus or bacterial deposits and creating a clean surface for tissue reattachment. Once curettage and root planing are complete, the wound edges are approximated to facilitate healing. Proper closure helps protect the area from infection and supports the regeneration of healthy tissue. After gingival curettage, patients should be given clear instructions for post-procedure care. This includes maintaining good oral hygiene, avoiding trauma to the treated area, and following any prescribed medications or rinses. Proper care is essential for optimal healing and preventing complications. While gingival curettage is generally safe, potential complications can include excessive bleeding, infection, or delayed healing. Most issues can be prevented with proper technique and post-procedure care. Patients should be monitored closely for any signs of complications. Follow-up visits are important to assess healing and ensure the success of the procedure. During these visits, the clinician will check for signs of infection, monitor tissue regeneration, and provide additional care as needed. Regular follow-up supports long-term periodontal health. Educating patients about the importance of oral hygiene and regular dental visits is crucial for maintaining the benefits of gingival curettage. Patients should understand the role of plaque control and the need for ongoing periodontal maintenance to prevent recurrence of disease. Good oral hygiene is essential for optimal healing after gingival curettage. Patients should brush and floss carefully, avoid irritating the treated area, and use any recommended rinses. Proper hygiene helps prevent infection and supports the regeneration of healthy tissue. With proper technique and maintenance, gingival curettage can lead to significant improvements in periodontal health. Patients often experience reduced pocket depths, healthier gum tissue, and a lower risk of disease recurrence. Long-term success depends on both professional care and patient compliance. In some cases, alternative treatments such as scaling and root planing, flap surgery, or regenerative procedures may be recommended instead of, or in addition to, gingival curettage. The choice of treatment depends on the severity of the disease and the patient's overall health. Gingival curettage may not be suitable for all patients. Contraindications include acute infections, uncontrolled systemic diseases, or insufficient attached gingiva. Careful patient selection is essential to ensure safety and effectiveness. Gingival curettage offers several benefits, including the removal of diseased tissue, reduction of inflammation, and promotion of gum healing. When performed correctly and followed by proper maintenance, it can significantly improve periodontal health and patient quality of life. To recap, gingival curettage is a valuable periodontal procedure for managing inflammation and supporting gum health. Understanding the indications, techniques, and healing process is essential for both clinicians and patients. With proper care, the outcomes are generally positive and long-lasting. For those interested in learning more about gingival curettage and periodontal therapy, consult reputable dental textbooks and peer-reviewed articles. Staying informed about the latest advances ensures the best possible care for patients. Thank you for joining us in this comprehensive overview of gingival curettage. We hope this guide has provided valuable insights into the procedure, its benefits, and the healing process. Remember, maintaining good oral hygiene and regular dental visits are key to long-term periodontal health.